literally saved someone's life my last shift, and I want to talk about it because something could have been done in order to prevent this from happening. Just to kind of set the scene for you guys, I had a one-to-one patient, but I was sitting in between two ICU rooms, so I could see into my patient's room. I also could see into the other patient's room that was not mine. And even though I wasn't like technically responsible for that patient, it's hard not to just like keep an eye on them. It's like when you're at the park and you're watching your kids, but you're also kind of keeping an eye on the other kids, making sure they're not doing anything. And so I would occasionally glance up, check on the patient, kind of glance at their monitor. Well, I happened to glance up, and this patient's blood pressure was super, super low. I'm talking like 30s over 20s. But nothing was alarming. So I was like, that doesn't make sense. Like, this should definitely be alarming, even if it's not an accurate blood pressure. So I go in and troubleshoot, and at first I thought, oh, this is probably not accurate, but upon further evaluation, the blood pressure was very much so accurate. It was so low that it looked like a flat line on the arterial line. I had to optimize the scale, and when I optimized the scale, I was like, ooh, yeah, this is legit. So I called in for help. We got the patient stabilized, but the alarm was not going off on the patient's A line. And so at some point, that patient's arterial line alarm got turned off, which is a big, big no-no. Even if your patient's arterial line is not accurately reading, you should never, ever, ever turn the alarm off. You can adjust the parameters to be appropriate for that patient. You can take the line out if it's no longer working. Never shut off the alarms, because if that patient were to pull that arterial line or your patient's blood pressure drops to 30 over 20, we need to know. One of the first things I do when I walk into my patient's rooms in the morning is I check their monitor. I look at all of their alarms to make sure they're turned on. I look at all the parameters to make sure it fits for that patient and is going to be appropriate for that patient. Your alarms are your extra eyes and ears when you are not in that patient's room. Alarms, as annoying as they can be, are there for a reason. So never, ever, ever shut off your alarms.